Hi, everyone. It's great to see you here. I'm Dr. Miriam Smith, the host for Empowering New Nurses. I'm excited that you're here today. Today, I'll talk on baby hunger cues. It's important to know this because these babies are not able to communicate verbally, and therefore, they let us know by their actions and their activities. So one of the first hunger cue for our baby is rooting. That is reflex, turning the cheek, turning the head towards the area that is being touched or anything brushes on. So that is, baby goes towards, that is inclined to go towards that stimulus. Okay. Now, mouthing, moving the mouth and the tongue, and with the tongue and like that. Moving the fingers towards the mouth, yes, and also the fist towards the mouth. Increased in frigidity, yes. Lip mouthing, smacking, the tongue. And let me let you know that crying, although when the baby cries, is a last or as a late hunger cue. And no, it's harder to calm the baby in order to take the food. So we would definitely try to prevent the baby from start crying. So identify the needs before you actually reaches that point. Baby become very fussy or irritable. So apart from the hunger cues, baby can get fussy if baby's wet or so or uncomfortable. But this time we're talking about the hunger cues. Now, if you notice, the baby can become very, very excited when he or she sees the bottle coming toward, or being able to identify with the person who cares for him or her. Babies, again, are not able to communicate verbally. And so they communicate non-verbally. And we have just mentioned different things that they will do. Now, from my personal experience, I must let you know that I just had twins grandbabies, and they are 5 months now. And even this morning, I was able to identify the hunger cue. I see the baby was looking at me, and the baby, just started like with mouthing or just starting to get a little irritable. And believe it or not, as the feed came, the baby was just so excited, and they look forward to that, so that they can enjoy their meal. So it's our responsibility to help to prevent them from being in that crying stage, which you have to calm them down and for them to get back to that position and that being able to be cuddled and be able to enjoy their food. Now, this information is relevant and it's applicable to not just moms and dads, but also to relatives, family members, friends, caregivers, babysitters, and the list goes on and on. Once you care for or you need to be refreshed, your maybe first parents, but whether or not, because parents from maybe some baby boomers or so, they might argue that they fed their babies like every 3 hours or so before. But it has been proven that babies should be fed on demand. Yes. So that's very, very important to feed the babies on demand. I'm about to leave right now, but and in my book, Nurse, the Guide to Empowering New Nurses in the Delivery of High Quality Care to All Patients. This is an Amazon bestseller. Okay, it's both in Kindle and paperback, as you'll see here. There's so many nuggets, pearls that are in it that you can embrace. Apart from the baby hunger cues and breastfeeding, I do have mindset, the group mindset. That's to start. I have communication. effective communication, which I'm thinking of the clarity, brevity, of course, the time frame, and the information, the relevancy of the information that is being conveyed. Very, very important. So I do have loss, grief, and grief. And, we had the pandemic, and we have different type of deaths, and many people are grieving even till now. And of course, seeking professional help if it's out of the range, and the range might definitely vary for different individuals. So I do have areas of, okay, hygiene, hand washing, and it might seem simple, but so, so important, because not everybody complies. Not everybody complies with hand washing, which is one of the most single way of transmitting diseases, and how long, you may ask you might have to wash your hand, and wash it at least 20 seconds. Yeah. So the book has so much to offer. Talks about leadership. It talks about advocating for patients, advocating for yourself. The fears, the roller coaster fears that the nurses experience, especially in those for a few months into maybe the first year, or even more, depending on the area of specialty. So I've given in this book, I've put together experiences of myself and of others. And I do have more than 4 decades of experience that I've gleaned, and this experience have helped me to be successful in different areas as a critical care nurse. And I've worked in different capacities on my nursing journey. So it gives me great pleasure to share with you information in this book that can enhance your nursing journey also. Of course, there have been recommendations, but at the same time, you have to pick your pearl, because experience in the past, the present, and of course, we're going into a futuristic time where our innovativeness was healthcare, adjustment, and creating new models for this time, and for the systems in place to ensure that our patients receive the best care, teamwork, and all of that. Those are segments of the book. It's interesting. I've listened to those who have read, and you will see coming up, you'll see individuals that I have interviewed. You will hear from individuals who are non-health providers, non-health care people, and non-health care personnel. You'll also hear from the interprofessional team. I've had occupational therapists, I've had respiratory therapists, and social worker will be coming up, educators, and I've said, of course, seasoned nurses. So there is something there for you. And I've listened to young nurses who have read the book and have been excited, and I've listened to my different talks, and are willing to share, and are excited that they have gained such information, knowledge. So let me say thanks for listening, and I look forward to you doing just well. Connect with me at Miriam Amanda Smith on YouTube, Podcast Mir, and Instagram. Also on Facebook and TikTok, Spotify, of course, and Apple. Thanks. Have a great evening. Bye.